Well, so thanks, Elfar. I'm Tim Padera from Mass General Hospital. I'm coming to this more from a basic biologist morphing into imaging. But the major area of interest in our group is really studying the lymphatic system and its functionality, its growth, its maturation in sort of normal conditions and in disease processes such as cancer. The lymphatic system obviously plays a huge role in the ability of cancer cells to spread throughout the body. And just to sort of give some motivation behind studying the lymphatic system, about a third of all cancer patients walk into their doctor's office with a diagnosis of lymphatic metastasis. In addition, lymphedema is becoming a larger problem because of cancer therapy. About 3 million people in the US have lymphedema as a result, which forms nituses of infection, which lead to cellulitis, and about 400,000 hospital admissions in the US usually treated with IV antibiotics. And then worldwide, there's a process with lymphatic filarial infection leading to elephantiasis, and this is just massive, massive debilitating lymphedema. And it's thought that about 120 million people have this infection, with about another 1.2 billion at risk. The major issue in lymphatic research is that not a lot of the underlying biology is understood, and so that's sort of where my group is trying to make some headway, and we use a lot of intravital imaging techniques to try and get at this biology in living mice. Using multiphoton microscopy and other fluorescence techniques. You can see one of the interluminal lymphatic valves in here with some lymphocytes about to pop through. We can also look at the lymph node. Here you see some green cancer cells entering the lymph node with our lymph dyed in red and some second harmonic to show the capsule. And then more recently with collaborations with Ben Vakic and Brett Booma over the Wellman Center, looking at using OFDI to pick out lymphatic vessels around growing tumors and in other conditions. So just to sort of give a glimpse of some of the biology we've been able to uncover, we looked at one major axis of lymphatic growth, this VEGF-C, which is a growth factor binding to VEGFR3, its receptor, and have shown that this axis can play a major role in the spread of cancer from the primary site down into the lymph node. And sort of where we're heading with this research is trying to study now what's actually going on in the lymph node and how just a few cancer cells in the node can start developing and growing and potentially spreading further. So, as a biologist asking a bunch of optics people and imaging people for wish lists, I think this is sort of at the top of the list, is ways to actually figure out who has disease in their lymph nodes, and usually micrometastatic. So detecting just a few cells in the lymph node will have a big impact on how patients are classified and treated. And then other issues with the way I'm currently doing my research is I'm always injecting dyes to highlight lymphatics, and that is altering the physiology. So methods to quantify lymphatic function, lymphatic flow without having to inject any contrast agents would be ideal as well. So thank you.